Welcome. I hope you guys are doing well today. In honor of Melanoma Monday, we are doing an upper body skin exam on my wonderful colleague, Mackenzie.
Hello.
Mackenzie is one of our head medical assistants. Many of you have met her. I couldn't do anything without her. She's like a daughter to me. So I always say I have to take really good care of her skin because I don't want anything to happen to her.
Exactly.
I do love her. So my wonderful Mackenzie has used tanning boots in the past. Mackenzie, why don't you tell them about your experience?
I used tanning beds for probably about 10 years. I would go about 3 or 4 days a week, so I just have a lot of moles. I know, so I don't tan anymore, but so now I just want some of my moles checked. So
what I'm going to do is I'm just going to clean my hands. I'm going to take a little look at all of Mackenzie's upper body moles, especially where she got her tanning bed exposure. Whatever's looking atypical, you'll see we easily take off in just a couple seconds. It'll be great.
Okay, sounds good.
Anything you were worried about, Mackenzie?
I do have a couple moles on my right arm area that are just a little dark and irregular looking from what we see
here. If you
here.
can cover yourself appropriately, and then we'll get these little guys taken a look at. Yes, so from having done Mackenzie's full body skin exams before, I can tell this one is darkening up a little bit, and with her history of tanning bed use, I wouldn't want it on myself. I definitely wouldn't want it on somebody who's like a daughter to me. So we're going to do a tiny little removal on that guy and that guy because of the two colors.
Sounds good.
This mole looks like something called a congenital nevus. It looks like something Mackenzie has likely had her whole life. It's starting to get a little bit of a regular border. So for that, what I'm going to do is just take a photo for my chart, and I'm going to recheck in about 6 months to make sure it doesn't change.
Sounds good.
So we'll get those two off.
Okay.
What's going to happen next, I'm going to clean the areas. Lisa, if you can give me some alcohol.
Perfect.
This is Lisa. Many of you know
Hi.
Lisa too. She's awesome. So let's go ahead and clean everything.
Yeah.
A lot of my patients know I use this buzzer device. It helps vibrate the skin a little bit. A lot of people make jokes about that. But it distracts the nerves. Lisa, actually give me 3 punch, please.
Yeah.
It distracts so it doesn't hurt quite as much. So I'm going to use this vibration device. Lisa's already cleansed it. Okay, Mackenzie.
Okay.
On the count of 3. 1, 2, 3. How you doing, dear?
Good.
You can see I'm also rubbing her shoulder a little bit. That just helps, again, as a distractionary technique. How you doing, Mackenzie?
Good. Easy.
Perfect. So you can see that nice little lift. That'll allow me to lift that away. Ready, sweetheart?
Yep.
1, 2, 3. Pinch. Doing okay?
Yep.
Perfect. So again, you can see that numbing medicine is just flowing in the skin. Awesome. Lisa, I'll take one more numbing. So I don't want anybody that I love to have any pain, so I'm going to just check again.
No pain.
Any sharp?
Nope.
Any sharp here, my dear?
Nope.
Perfect. Let's check here. Sharp there, Mackenzie?
Nothing.
Anything there?
Nope.
So we really just want to lift this away very, very, very superficially and leave as minimal of a scar as possible. But I also want to get all of the pigment. I don't want anything to ever come back from my Mackenzie. Sometimes with these darker ones, if we go too superficially, the pigment will come back, and I don't want that to happen. So I'm going to use this tool called a punch biopsy. The punch goes a little bit deeper in the skin. Then I just lift it away. And it's done. The mole is removed. Same thing. Tiny little punch tool. I'm going to just lift that away. And nice thing, I don't know if you can really see, there's no pigment inside, so I've really gotten the base of it. So God willing, that should be all clear.
Sounds good.
I don't stitch these holes because in my experience I've seen if we put little strips called butterfly strips or steri strips right on top of it, it brings the skin together, and then there's none of those ugly track marks. Because, you know, she's a pretty young girl. I don't want her to have like railroad track marks on her arm. So that's what mole removal is. Mackenzie's going to do great. Lisa will steri strip these. We'll keep them clean, and we'll go from there.
Sounds good.
And no pain with this because Mackenzie's numb. She'll be numb for a few hours after this. Am I hurting you at all?
Nope, nothing.
Perfect.
Awesome.
Awesome. So
Thank
last
you.
step, Lisa's going to hold the pressure and put the steri strips on. But especially individuals who've used tanning beds in the past, it significantly increases the risk of melanoma. There are statistics that show even one tanning bed use increases your risk of melanoma by 30%. And going 3 to 4 times a week,
I know.
No more. So if you're concerned about any mold, go see a board certified dermatologist. Get them off. It's always better to be safe than sorry.